Chapter. Financial issues. Key terms. Pharmacy benefit managers or PBMs. Companies that administer drug benefit programs, for insurance companies, HMOs, and self-insured employers. UCR. The maximum amount of payment for a given prescription, determined by the insurer to be a usual, customary, and reasonable price. Co-insurance. An agreement for cost sharing, between the insurer and the insured. Copay. The portion of the price of medication that the patient is required to pay. Dual copay. Copays that have two prices, one for generic and one for brand medications. Maximum allowable cost, or MAC. The maximum price, per tablet or other dispensing unit, an insurer, or PBM will pay for a given product. Online adjudication. The resolution of prescription coverage, through the communication of the pharmacy computer, with the third-party computer. Deductible. A set amount, that must be paid by the patient for each benefit period, before the insurer will cover additional expenses. Formulary. A list of medications covered by third-party plans. Prescription drug benefit cards. Cards that contain third-party billing information for prescription drug purchases. Tier. Categories of medications that are covered by third-party plans. Health maintenance organizations, or HMOs, are a network of providers who are either employed by the HMO or have signed contracts to abide by the policies of the HMO. HMOs usually will not cover expenses incurred outside their participating network. Point of Services Plans, or POSs, are a network of providers, contracted by the insurer. Patients enrolled in a POS choose a primary care physician, or PCP, who is a provider in the insurer's network. Patients may receive care outside of the POS network, but the PCP is required to make referrals for such care. POSs often partially reimburse expenses incurred outside of their network. Preferred Provider Organizations, or PPOs, are a network of providers, contracted by the insurer. PPOs offer the most flexibility for their members. PCPs are not required to be part of the network, and POSs often partially reimburse expenses incurred outside of their participating network, and such care does not require a referral from the PCP. Medicaid. A federal and state program, administered by the states, providing health care for low-income households. Medicare. A federal program, providing health care to people with certain disabilities, or who are over age 65. It includes basic hospital insurance, voluntary medical insurance, and voluntary prescription drug insurance. Patient assistance programs. Manufacturer-sponsored, prescription drug programs, for low-income individuals who lack insurance coverage, and require medication. Workers' compensation. An employer compensation program, for employees accidentally injured on the job. Prior authorization. A procedure, to gain third-party coverage, for a drug that is not automatically covered by a third-party plan. CMS 1500 form. Standard paper form, used by healthcare providers to bill for services, including disease state management services. Universal Claim Form, or UCF. A standard paper claim form, accepted by many insurers. Key concepts. Financial issues. Third-party programs are simply another party, besides the patient, or the pharmacy, that pays for some, or all of the cost of medication, essentially an insurer. A pharmacy benefit manager, or PBM, is a company that administers drug benefit programs for insurance companies, HMOs, and self-insured employers. Co-insurance is essentially an agreement between the insurer and the insured to share costs. One aspect of it is the requirement for patients to co-pay a portion of the cost of prescriptions. The amount paid by insurers for prescriptions is not equal to the retail price normally charged, but is determined by a formula described in a contract between the insurer and the pharmacy. There is a maximum allowable cost, or MAC, per tablet or other dispensing unit that an insurer or PBM will pay for a given product. The MAC is often determined by a survey of the usual and customary, or UNC, prices for a prescription within a given geographic area. This is also referred to as the UCR, or usual, customary, and reasonable price for the prescription. Third-party programs. Deductible refers to a set amount that must be paid by the patient for each benefit period before the insurer will cover additional expenses. Prescription drug benefit cards contain necessary billing information for pharmacies, including the patient's identification number, group number, and co-pay amount. A patient identification number is assigned to the patient by the insurer and is indicated on the drug benefit card. Most third-party plans require that most of the medication has been taken before the plan will cover a refill of the same medication. Most prescription claims are now filed electronically by online claim submission and online adjudication of claims. In online adjudication, the technician uses the computer to determine the exact coverage for each prescription with the appropriate third party. Third-party programs. When brand-name drugs are dispensed, numbers corresponding to the reason for submitting the claim with brand-name drugs are entered in a DAW, or dispense as written, indicator field in the prescription system. HMOs usually will not cover expenses incurred outside their participating network, and often require generic substitution. POSs require PCP to be part of their network, and often partially reimburse expenses incurred outside of their network, but require a referral from the PCP. They usually require generic substitution. PPOs do not require the PCP to be part of their network, and often partially reimburse expenses incurred outside of their network. No PCP referral needed. Medicare covers people age 65 and over, disabled people under 65, and people with kidney failure. Medicaid is a federal and state program for those that meet the requirements of low income. Workers' compensation is a compensation program for employees accidentally injured on the job.